Hello, everyone. I'm Jason Tokarski.
And I'm Megan McGurman. Welcome to For the Love of Health, brought to you by ChristianaCare.
According to CDC research, about 1 in 8 women with a recent live birth reported symptoms of postpartum depression.
Postpartum depression is just one perinatal mood and anxiety disorder. To dive deeper into this topic, we're joined by psychologists Malina Spirito and Paige Brown from ChristianaCare's Center for Women's Emotional Wellness. Malina and Spencer, thank you both so much for being here today.
Thank you. We're thrilled to be here.
Thank you for having us.
Let's start by laying the groundwork. There are a lot of different terms that we may discuss today that have to do with postpartum. What are the terms that are considered part of perinatal mood and anxiety disorders?
Yes, there are several. The first one would be like the baby blues, postpartum depression, postpartum anxiety, postpartum OCD, psychosis, and postpartum anxiety.
Mood disorders and bipolar as well, right?
Yes.
And I think unless you're actively experiencing one of those or have a loved one who is, half of those terms you've probably never heard of, especially never talked about. Mm-hmm. Why is it so important that we're having this conversation today?
Exactly what you just said. The fact that there's such a range of disorders that can impact folks during the entire perinatal time frame. So that goes from the time of pregnancy all the way up through 1 to 3 years post-delivery, postpartum. And too often, our society hasn't talked about this enough at all, but definitely what we usually talk about is postpartum depression, and fail to recognize that there's a range of disorders that can impact people, especially anxiety. As Spencer mentioned, it's something that often goes overlooked and can be really, really scary for folks. And at the same time, unfortunately, because it doesn't get talked about and people don't recognize that these truly can be disorders that can be treated, people walk around thinking this is normal, which really has a harmful impact on what their parenting experience is like when they think this is normal, and it's terrifying and I hate it.
Absolutely. And Malina, you said 1 to 3 years post-delivery. Is postpartum really that large of a time frame?
Yeah, it really can be. Obviously, like symptoms can emerge and then continue to exacerbate throughout that entire time frame. Doesn't mean that it will typically last up to 3 years. We see women get better within a couple of months, but for some women, it does last up to about 3 years.
Especially if they don't get help earlier on. So we do know that these are disorders, challenges that are highly treatable. So if somebody gets into the treatment that they need, they have a much better shot of getting well quicker.
Some of this seems a little newer to me. And I say that from someone, my kids are both in their late teens at this point. You know, baby blues, yes, heard about that. But some of these other things I don't recall hearing about when my wife was pregnant with ours. So how prevalent is this? What are some of the statistics about how many people are seeing this and acknowledging it compared to, just a couple decades ago?
Can't tell you how many times people will come into our office for treatment and will say, as I've been talking to my family members, my mom or my aunt has acknowledged that she thinks she had this too. So it's always been around. It just wasn't acknowledged. It wasn't talked about. I think lots of folks are shocked to find out that, generally speaking, 1 in 5 women will experience perinatal mood or anxiety disorder through pregnancy and the first year postpartum. So that's 20% of people. And 1 in 10 dads and partners will experience it as well. In fact, to put that into simple terms, perinatal mood and anxiety disorders are the number 1 complication of childbirth, which is really huge when you think about in the obstetrical world how much emphasis we place on things like hypertension and gestational diabetes and preeclampsia. The reality is that perinatal mood and anxiety disorders accounts for more than all of that.
And would you say things like preeclampsia make the mood disorders worse?
Oh, it's definitely a major risk factor. And it can go in reverse as well. If a person has depression or anxiety in pregnancy, it is certainly a risk for driving health concerns like hypertension, poorly regulated blood sugar, things like this, and vice versa. So it's why I think it's so incredibly important that we're addressing both the physical components of a pregnant person's health as well as their mental health.
And when you think about it, pregnancy is a whole life transition, whether it's emotionally, physically, socially. it impacts the whole spectrum. And so with that, when we think about just a normal transition into motherhood, about 85% of women experience the baby blues. And a large part of that is due to that transition into motherhood, and then also the hormonal changes that occur during pregnancy and postpartum as well.
In exact opposite kind of to Jason, I have a 3.5-year-old and an 8-month-old. So I am clearly to our definition of postpartum earlier, still in the thick of it. And this is something that, many of the new moms that I'm friends with, we have these kind of conversations a lot. How do you see this just being a more open and honest conversation? And how do you think that's really helping the new moms of today?
Well, I really think that a lot of the younger moms are on social media, and I think social media is a really great platform to get a lot of good information from. And I think when women start to talk about what their concerns are in an open platform, it really destigmatizes a lot of their concerns, and they can find a lot of good connection with other women who are struggling and going through the same things that they are as well.
I just recently had a session and a patient shared something that I thought was, really cool. She was reflecting on meeting with a friend of hers who recently delivered a baby. And my patient, I've been working with her for a number of years through a number of pregnancies and children. And she was able to say, wow, looking at her, I see how far I've come in terms of the anxiety that I was struggling with. And I feel like I'm able to see her struggle and I want to help her. And I'm recognizing how for so long my anxiety was almost like a lifestyle that I had become accustomed to. And now I feel like I've been able to flip that script. And I'm so much more present and able to enjoy my kids and able to support the other moms that I'm friends with when I see them struggling. Because she said, I very much see in her what I was going through. The same things that she is worrying about are the things I worried about that today I see were taking me away from what I really wanted to focus on as a mom.
Because these perinatal mood and anxiety disorders impact everybody.
Mm-hmm. It definitely can be like a ripple effect within the family. So for example, with a mom who is struggling with postpartum depression, that may impact her ability to care for her baby, feel connected to her baby. If she has older children, that might impact her ability to engage with that older child, leaving that older child to feel neglected. It may also impact the marriage, the relationship with her partner. If your partner is not doing well and is struggling, 9 times out of 10, you may struggle and not really do well. It definitely is a large ripple effect throughout the whole family.
To your point, Spencer, when we look statistically at the breakdown of relationships, marital relationships, parenting relationships, that first year postpartum after the delivery of a first baby is the highest rate of when we see relationships dissolve. So it just speaks again to that ripple effect and the importance of people, parents, taking care of themselves and addressing when something's not right, when something's not feeling right, what can we do to get a handle on it?
And also the leading predictor of paternal depression is maternal depression. And so if mom is not doing well, then partners may not be doing well either.
Talk to us a little bit about the ChristianaCare Center for Women's Emotional Wellness.
Center for Women's Emotional Wellness has been around for 12 years now. We started as a tiny little 3-person practice providing outpatient psychotherapy and inpatient consultation for our obstetrical units. Today, we've grown a lot. We now have 13 different clinical providers that are able to offer outpatient psychotherapy, psychiatric medication management, as well as our inpatient consultations, as well as consultations throughout all of our women's health practices and the broader community. One of the cool things about our program is that you do not have to be a ChristianaCare obstetrical patient in order to receive psychiatric or psychotherapy services with us.
Obviously, I know this is the ChristianaCare Center for Women's Emotional Wellness, but if we're talking about parenting, do you approach paternal mental health in the course of this as well?
Very proud to say that now we do. That's been a big piece of our evolution over the last 12 years. One of the newest developments for the Center for Women's Emotional Wellness is that we are opening ourselves up to providing more services for dads specifically.
What kind of success have you seen there? Because I think a lot of the fathers are, I'm good. I think that's even more of a struggle than talking to that postpartum mom and having her admit that she needs, someone to talk to. What kind of success are you seeing when these dads say, like, I could use some help too?
I mean, when we do have a father that does come in, I think he's usually very receptive to kind of learning about how to support his partner, to how to support his wife or the mother of his child. And so we tend to see that it goes really well when we include them.
And I think recently we are seeing a growing number of men and that are aware of how birth trauma or perinatal loss and grief has impacted their own well-being. And so I am seeing a larger number of folks that are open to coming in for their own treatment, even if it's not so much about their wife. It's about wanting to come in and take care of themselves so that they can be present for their family. We're seeing more of that today than we have over, the last decade.
We talked about how, when Jason was a new parent 20 years ago, none of this was really discussed. I have my own littles now, and it's becoming much more of a common topic. Where do you hope it goes 10, 20 years from now? Where is room for more growth in this space?
My hope is that women continue to talk about their struggles openly in pregnancy and postpartum, continue to seek care, continue to connect with other women who are struggling. I think when we build that connection up and build that support up, I think that women tend to have a lot of success.
Absolutely. And with regard to healthcare, I want to see us continue to grow in our presence within the women's health field. I think that we've made great strides already, but there's still a lot more room to grow for bringing mental health care directly into the OBGYN women's health care office. And we don't need to wait until there's a problem. I think if we can monitor this and make this a routine part of our health care, we can stay ahead of this.
So for the new parents who are possibly going through this, what should they be looking out for? What are some of the warning signs that they should have an eye out towards that might want to make them reach out to you?
So if your partner is experiencing like a lack of interest, not bonding with the baby, feeling sad, feeling overly anxious or overwhelmed, not sleeping is a really big warning sign, not just due to the baby not sleeping, but mom is just up worrying all night, can't focus, always kind of checking on the baby, in the middle of the night. Those are some warning signs that, things may not be going well.
I think every symptom that Spencer has mentioned, especially the sleep one, we know is huge. But sometimes qualitatively, what I'll say to a person is just, is this feeling like what you wanted it to feel like? Are you enjoying this parenting experience in the way that you wanted, or does something feel off? If something feels off, it's okay to say so, and it's okay to ask for help. I always tell people, you don't need to wait until it's that bad. A lot of times people will say, well, I didn't think it was that bad, so I didn't come in earlier. I tell people, it doesn't need to be that bad. If something feels off, speak up and you can come in because we can get you well. So I want people to come in as soon as they feel like something's off.
I love that because I think there's a spectrum to this.
Mm-hmm.
And I think a lot of women say, I'm not great, but it's not that bad. Like I can make this work. It's okay. But you don't have to wait until you're really in the dark.
Absolutely. Absolutely. I couldn't agree more. And I don't know why in our culture for so long, women especially have said, well, it's not that bad. We're allowed to ask for help, especially because the help is available.
And it's just okay to not be okay and to be able to come in and talk to someone about things not being okay.
Absolutely. Malina and Spencer, thank you so much for your time.
Thank you.
Thank you.
More information on ChristianaCare's Center for Women's Emotional Wellness are on the show notes for this episode.
You can always keep up with For the Love of Health on social media. Just search ChristianaCare on your favorite platform.
We'll be back in 2 weeks with another great conversation.
Until then, thanks again for joining us.
For the love of health.